My name is Beatrice Wamuti. So I'm a medical doctor originally from Kenya, and I have a PhD in implementation science from the University of Washington, and currently a postdoctoral fellow. I think I'll reiterate what has just been mentioned. I was quite surprised to see the congratulatory messages like, oh, okay. Um, and I'm very excited to be joining the team. I think more to really think about implementation science, and I think about it from a very practical lens where we're trying to really reduce the no-do gap between what we know, what has been researched on, and what's actually in practice. In terms of my current scope of work right now, I do a lot of support as a senior technical advisor with the Ministry of Health, and also supporting some of the work being done by the WHO, the Global Fund, really trying to move the needle from what we see being done in countries, what has been researched, trying to put those in guidelines and actually going on the ground and ensuring that it's actually been implemented. And if not, what are the challenges, what are the facilitators, and how can we make sure that whatever we are finding in research really translates to improved health outcomes. So I'm very happy to be to be joining the group, and I look forward to interacting more with you. Thank you.
I am Maria Fernandez. I'm a professor of health promotion and behavioral sciences at University of Texas School of Public Health in Houston. I have a long history in the field of implementation science, probably since 2002. I started getting very interested in this field and have been involved in many efforts for training and capacity building, both in the United States and globally. Over the last several years, I've been particularly interested and participating in efforts in low and middle income countries to not only bridge the gap between research and practice, but also bring the worlds of implementation research and implementation practice together. And it was one of the things that made me very interested in the work of this society. Um, I am I have a great interest also in advancing the methods and practice of implementation science. I think that even though we can't say that we're in our infancy anymore as a field, there's still much to do and much to learn, and growing the knowledge base of what we mean by implementation science, but also in a way that is pragmatic and usable, I think is a strong interest of mine.
I'm Ejimai Boreme. I am a medical doctor, public health physician from Nigeria, although currently in Canada, in Alberta, University of Alberta, as a research associate, and I still do hold a position in Nigeria as senior medical officer at the National Primary Care Development Agency, which is a policy organization, but I think I'm now transiting more into academia. Yeah, yeah, and I do belong to several networks in Africa. One is the Nigerian Implementation Science Alliance. I am a member of that organization, and also the West African Network of Emerging Leaders in Health Policy and Systems, and also the Health Systems Global African Forum as well. So that's these are networks that aim to bring people who are interested in the evidence in strengthening the evidence to policy continuum, and I really think it's quite exciting to be on the board of GIS, which also has similar vision with these networks as well. Thank you.